Thank you, everybody, and thanks TCOE for giving us an opportunity to present one of our products, which actually we are working for at least about 6 to 8 months with the Ministry of Health and understanding what are the challenges that they are facing in the field when it comes to monitoring the health of mother and child. So we have done some innovation around that, and as we being a communication organization, so the key to this product or key to this solution is communicating from the field to the right channels, which could be the public health centers, which is the state health centers, and of course right reporting for the right time and being innovative. Can we go to the next slide, please? The next one. So I'd like to take you through some challenges that currently it's faced in the field, and I'd like to take you through the objectives and what is my application, what is the process of that application, and a few outcomes from the pilot that we've currently run, which is live today in one of the states, which is Madhya Pradesh. So I'd like to take you through that. So current challenges, what we see is that today the data which may be being entered manually by the ASHA and the NM workers may not be in the right format, or may not be at the right speed, or today if the data is being captured, it may be getting entered after 15 days because it's a manual entry. They have to go to the block offices or the district offices to submit that data, and whatever data is being entered may not be even correct in nature. So there may be a duplicacy of data, or there may be some error which they mention in the names or in the age or in the trimester that the pregnant lady would be in that current scenario. There may be some efforts that these people will be taking. So yeah, we can go to the next one. So there is a project which we are doing in state of Madhya Pradesh, and the understanding that we had that this state has the highest child mortality in comparison to the entire country. So that's the reason why we took this state as one of our pilot projects, and this is a small village or district called Mandla, where we took a few ASHA and ANM workers as our I would say leaders to manage this pilot and give us this desired results, which probably we would take forward to other states as well. Can you go to the next one, please? So here we are talking about some tools that we have proposed to them. First of all is the mobile field services, where we talk about how the data is being captured and how the data is being sent to the various districts, linking the health centers from the ground level, from the ASHA workers' device. They are linked to the health centers, and that's the data is flowing through them. Then government management tools, I would say how they are being tracked, how the location of the ASHA workers is being tracked, how the data is being rightly sent for managing or understanding which are the high risk pregnancies in the field, or if there is some sort of a change in the mother's home, or if she's going for her delivery to her parents' home. Today there was no visibility around these things, so these are the tools that we are giving to the government today. This is a little screenshot of what are the screens or what are the fields that we are capturing in the application. First of all, they're doing a live registration of the eligible couple. So when I say eligible couple, of course these are the beneficiaries from below poverty line who are getting this kind of an aid from the government. The registration happens. Then the pregnancy registration is going to happen post that. Then there are some sort of background of the pregnant mother which can be captured and sent across to the hospitals or the related hospitals where the case is registered. If this seems to be a high risk pregnancies, the doctors at those health centers will be able to deliver the right medical facilities, or will be able to guide the ASHA workers to give them that kind of support on the field. Can we go to the next one, please? So these are, basically we are saying that whatever entry is happening, even the location of that entry is being captured. So the right location and the right data entry at the same time is being even viewed by the, the medical practitioners at those levels. There are certain medical devices also which can be actually linked to this application. So for example, if there is a blood pressure which is being monitored, or if there's diabetes being monitored, all these equipments can be connected to this device, and the real-time information of that kind of a data can be monitored by the doctors sitting at various health centers. So this is the most important slide of the entire project that we are talking about, which is the high-risk pregnancy. What we are talking about here is that today, if a woman has some sort of historical background to having a bad pregnancy in the first one, or having some medical history where there has been an abortion or there has been some medical emergency, those kind of things are not captured and are not monitored as of now. So that's the reason why a lot of child mortality, or a mother during the pregnancy or post-pregnancy faces a lot of medical challenges. So these are few parameters which today we have captured and given it as a part of the application, which says that these are the the parameters through which a doctor can understand that this is a high-risk pregnancy, and the required medical help, or the kind of medication can be rendered to these people sitting in the remote areas through the ASHA and ANM workers. These are some of the devices which can be connected to the device, like the thermometer or the pulse monitoring, or blood pressure, or even the diabetes. So this is what can actually be done from the field itself. The next one. Can we skip this one, please? So how the information is flowing, so it's just not one-way communication, it is a two-way communication. So if a beneficiary or the expecting mother needs some help, or needs some sort of monitoring, or needs some sort of information, it can be passed on to her through an SMS or an outbound call. So when you're calling up expecting mother and telling her that these are the kind of supplements or these are the kind of precautions she needs to take, that kind of a facility is available real time, and that can happen through any of the communication channels that we have today. Here's the next one. So we are talking about, this is precisely what I spoke in my previous slide, that all the information on whatever data is being captured from your blood pressure or diabetes can be immediately ported in the application and seen by the doctor. Here's the next, please. Next one, please. So these are few application features we are talking about. There is a data can be sent in an encrypted format. It can be done in any kind of a regional language. So language is not a bar here. It can be done in Hindi, English, Malayalam, Telugu, whatever languages you're looking at. It can give, as I said, it can give alerts over high-risk pregnancies to the doctors. And early warning can be obviously given to the doctors that this is the kind of medical support that the lady requires at the field level. We can look at very good data reporting and analysis on that data. So if if a state gets to understand that these are the kind of cases which are being registered and these are the kind of cases that need more help, they can go back to the field and do, as per the reports and the analysis that we are sharing, they can start talking about better measures of medical support in the field through various means and modes. So while we did this project, these are few of the findings that we have got. These are the number of, the couples that we registered, high-risk pregnancies that we actually were able to find, through our application real time, and through that, I think doctors have started talking to their patients in a more structured manner, and started talking to the ASHA workers in a more structured manner, getting to understand that how they can make things better for the people in the remote areas where today they do not get the kind of aid that they're supposed to be getting. So if they're supposed to be getting an amount which is a 2,000 rupees per month as a a facility to buy food or buy medication or get the supplements, they are not getting that, and there is no way of communication from the beneficiary that they can understand how to get the benefit out of beneficiaries. So now these are few dashboards that I would like to just run through. You can go to the next ones. So these are kind of reportings that we are giving to the department or to the authorities to understand. Please skip this, please. Next one. Next one, please. Next one. So this is our approach, that we want to be a part of National Health Mission in this project, and we want to support the Ministry of Health through our innovative solution that we have today by making monitoring more simpler for them, by enabling the ASHA workers on the field through our solution, by talking about the kind of reporting, the real-time reporting to make the machinery more stronger. We are even looking at the mother and child also will be benefited out of this solution. So as I said, it's a two-way communication. We would really like TCOE to support us, reach out to the various departments, various states, to talk about our innovation, talk about our solution, wherein I would say that we being a telco, which is not the first preference to any government organization as a communication channel or as a telco. So we would request that we may be supported in this particular area of giving a lead or giving a support on reaching out to these various departments that we are talking about. So that would be all from my side. Thank you.